Bismillahirrahmanirrahim. Assalamu alaikum. I welcome you all to my video channel Comprehensive Pharmacognosy Review. Let's start MCQs on pharmacology. Today's topic would be asthma and chronic obstructive pulmonary disease, that is COPD. But before that, I am Tariq Sultan. Question 1. You are treating a patient with bronchial asthma with an inhaled beta-adrenergic agonist. Patient calls your office complaining that the inhaler is not working. On questioning, it appears this person has an elevated heart rate. The most appropriate course of action is to A. Add an inhaled glucocorticoid to the regimen. B. Administer a systemic glucocorticoid. C. Immediately stop the use of the inhaled agonist. D. Substitute an inhaled glucocorticoid for the beta agonist. E. Switch to a different inhaled agonist. In this question, on questioning, it appears this person has an elevated heart rate. Now this is a serious condition. The pharmacist can manage this serious condition by immediately stopping the use of the inhaled agonist. Therefore, C is the correct answer. Immediately stop the use of the inhaled agonist. Question 2. The tachycardia associated with the use of alpha-adrenergic blocking agents is most likely due to A. Blockade of the alpha-2 adrenergic receptors. B. Elimination of beta-adrenergic receptor activity. C. Inhibition of the cholinergic nervous innervation. D. Reflex activation in a recumbent patient. E. The release of epinephrine from the adrenal gland. Now the tachycardia is associated with the use of alpha-adrenergic blocking agents. Therefore, the correct answer would be the blockade of the alpha-2 adrenergic receptors. So in this case, the correct answer is A. Blockade of the alpha-2 adrenergic receptors. Question 3. The most likely reason for selecting a beta-adrenergic agonist with intrinsic sympathomimetic activity is A. Agents without intrinsic sympathomimetic activity are subject to first-pass metabolism. B. The need for an agent that has a prolonged duration of action. C. These types of agonists are very long-acting due to the covalent bond they form with the receptor. D. The potential to have less depressant effect on the heart. E. To prevent reflex tachycardia. Now here in this question, the most likely reason for selecting a beta-adrenergic agonist with intrinsic sympathomimetic activity is the potential to have less depressant effect on the heart, because this is quite a serious condition. We have to manage that. Therefore, the correct answer is D. The potential to have less depressant effect on the heart. Question 4. The use of beta-adrenergic agonists in bronchial asthma is mainly designed to A. Compete with alpha-adrenergic agonists. B. Inhibit the airway inflammatory response. C. Stimulate airway secretion. D. Manage acute contraction of airway smooth muscle. E. Prevent awakening during the night. Now, in question 4, the use of beta-adrenergic agonists in bronchial asthma is mainly designed to manage the acute contraction of airway smooth muscle, because this is quite a serious condition and we have to manage that immediately. Therefore, in this question, D is the correct answer. Manage acute contraction of airway smooth muscle. Question 5. The symptoms of allergen-mediated asthma result from which of the following? A. Increased release of mediators from mast cells. B. Increased adrenergic responsiveness of the airways. C. Increased vascular permeability of bronchial tissue. D. Decreased calcium influx into the mast cells. E. Decreased prostaglandin production. In question 5, the symptoms of allergen-mediated asthma result from the increased release of mediators from mast cells. Therefore, in this question, A is the correct answer, increased release of milliliters from mast cells. Question 6. Acute exacerbations of asthma can be triggered by all of the following except bacterial or viral pneumonia, which is the choice A. B. Hypersensitivity reaction to penicillin. C. Discontinuation of asthma medication. D. Hot dry weather. E. Stressful emotional events. In this question, all conditions are acute exacerbations of asthma but hot dry weather. Therefore, in this question, D is the correct answer, hot dry weather. Question 7. A 45-year-old male with a history of asthma has a peak expiratory flow rate PEFR of 65%, nocturnal wheezing once a month, and daytime wheezing usually less than twice a week. According to the National Institutes of Health (NIH) guidelines for the treatment of asthma, he has which type? A. Mild intermittent. B. Mild persistent. C. Moderate persistent. D. Severe persistent. In question 7, the correct answer would be moderate persistent. Therefore, C is the correct answer, moderate persistent. Question 8. A 45-year-old male with a history of asthma has a peak expiratory flow rate PEFR of 65%, nocturnal wheezing once a month, and daytime wheezing usually less than twice a week. According to the National Institutes of Health (NIH) guidelines for the treatment of asthma, he has which type? The patient in question should be treated with which two agents? A. Inhaled steroid and ipratropium. B. Inhaled steroid and albuterol MDI as needed. C. Inhaled steroid and aspirin. In this question, the most appropriate answer would be inhaled steroid and albuterol MDI as needed. Therefore, the correct answer is B. Inhaled steroid and albuterol MDI as needed. Question 9. A 15-year-old female is brought to the emergency department. She is breathing 30 times per minute, is unable to speak in full sentences, and has a peak expiratory flow rate PEFR less than 50% predicted. The preferred first-line therapy for her asthma exacerbation is A. Theophylline. B. Beta agonist. C. Corticosteroid. D. Cromolyn sodium. E. A and B. F. B and C. Therefore, in this question, the correct answer would be F, B and C. Question 10. The primary goals of asthma therapy in an adult patient include all of the following except A. Maintain normal activity levels. B. Maintain control of symptoms. C. Avoid adverse effects of asthma medications. D. Prevent acute exacerbations and chronic symptoms. E. Prevent destruction of lung tissue. In question 10, the primary goal of asthma therapy in an adult patient includes to prevent destruction of lung tissue. Therefore, the correct answer would be E, prevent destruction of lung tissue. Question 11. Which of the following tests is used at home to assess therapy and determine if a patient with asthma should seek emergency care? A. Forced expiratory volume in 1 second FEV1. B. Forced vital capacity FVC. C. Total lung capacity TLC. D. Peak expiratory flow rate PEFR. E. Residual volume RV. The correct answer would be D, peak expiratory flow rate PEFR. Question 12. The disease process of chronic bronchitis is characterized by 1. The destruction of central and peripheral portions of the acinus. 2. An increased number of mucus glands and globulate cells. 3. Edema and inflammation of the bronchioles. A. If 1 only is correct. B. If 3 only is correct. C. If 1 and 2 are correct. D. If 2 and 3 are correct. E. If 1, 2 and 3 are correct. D is the correct answer if 2 and 3 are correct.